things that I like to tell people is why I got into natural medicine. Because usually, whether you're a medical doctor or a chiropractor or an osteopath or whatever kind of doctor, you have to have some sort of a drive, some sort of an interest. Something usually pushes you in the direction of natural health and wellness. And for me, my personal story was my own mother. I was practicing just standard chiropractic care for about 7 or 8 years, and you know, chiropractors, we deal with neck pain, back pain, headaches, sciatica, bulging discs, and we do a really good job at it. And that was pretty much my niche. And the whole time, I didn't know some of the things that my own mother was dealing with, just with her own health and wellness. And you know, her being my mom, she doesn't want to share that type of information with me. But finally, she had got to a point where she thought, you know, there's got to be another way. There's got to be a different avenue I can take that might better benefit me. And so she came in one day and she brought her big bag of pills into my office. And of course, my jaw hit the floor. I thought, what are these medications and why are you on so many? And so she started to tell me her story. And she has a family history of heart disease, family history of cancer, high blood pressure, high cholesterol. It's just laid out in the DNA. So it takes quite a bit more effort for her to actually fight this and battle this. And so she went in to see her general practitioner and her OB-GYN, and of course it starts one day where, here, take this medication for your blood pressure, and then, okay, take this medication for your cholesterol, and then take this medication for hormone replacement therapy, and then take this medication for your headaches, and then, oh, you're having hot flashes now, well, let's take this medication for that, and you're having symptoms of menopause, well, let's take this medication for that. And then she had that baseline of medication, and they all come with what? Side effects. So she began to get the side effects of all the medications that she was taking. And so she goes back to the doctor. And he says, well, take this for the side effect of this. And I want you to take this medication for the side effect of this. And so she had just as many medications that she was taking to counteract the side effects of medications as she was taking medications for whatever her symptom or problem was. And at that point in time in my life, I thought, okay, something's not right here. I know this is not right. First of all, it should be a last resort to use medications to get you out of a position that you could get yourself out of without medication most of the time. But then when you're taking medication to counteract the side effects of medication, you've kind of gone into a realm that I don't like to see people go, and I certainly didn't like seeing my mother go. So, of course, she was getting side effects on top of side effects. So I said, you know what? Obviously, it's not within my scope to take you off all these medications right now, but I am going to tell you this. I'm going to commit to delving further into wellness, lifestyle changes, natural medicine. Have you ever heard the saying, food is medicine?
Yes.
Okay? Okay, so food can be your medicine, your lifestyle can be your medicine, natural things like botanicals, herbs, vitamins, minerals. There's a whole lot of things that you can take and put into your body if you know what you're supposed to take and counteract some of these baseline diseases and conditions that you're dealing with. And so that's what I did, and that's what boosted me into the direction of natural medicine, because I didn't like what I was seeing, first of all, with society, but then when it hits close to home. Anybody ever had anything hit close to home? And that's when you wake up, you get the light bulb like, oh, no more, we're done, we're going to figure out a better way to do this. And so that's what pushed me into that direction. And so for the second half of my career, I focused a lot on natural medicine.